If you follow the news, you've probably heard the word opioid and seen headlines like these.
President Trump doubles down on opioid epidemic.
America's opioid crisis, how prescription drugs sparked a national trauma.
The opioid epidemic, a crisis years in the making.
What doctors facing the opioid crisis need next?
One must-do fix for addressing the opioid epidemic.
Trump declares opioid epidemic a national public health emergency.
But what is an opioid? Scientifically, the word opioid refers to a kind of chemical that interacts with certain proteins in the brain called opioid receptors. There are even some opioids that are produced naturally by the body. Others are drugs you may have heard of, like morphine, Vicodin, and OxyContin, which are all strong painkillers. Even if these names don't sound familiar though, you probably know someone who has taken one of these drugs for something like chronic back pain or having their wisdom teeth out. Because of their association with addiction, opioids are sometimes portrayed as villains. Common use of phrases like opioid epidemic and opioid crisis show that there's an increasing public awareness of this connection. But opioids aren't just the villains that they're sometimes made out to be. Different kinds of opioids are useful for lots of different things. Did you know that there's research being done to use opioids to treat addiction? My name is Deanna Montgomery. I'm a PhD candidate in medicinal chemistry at the University of Michigan, and the goal of my research is to develop a drug to treat drug addiction. Here's the thing about addiction. It's really complicated. There are psychological, social, emotional, environmental, and physical factors at play. There's been a lot of research done that has shown us that drug addiction causes physical changes in the chemistry that happens in the brain. Behavioral therapies like counseling and rehab are important to address the other factors of addiction, but they can't do anything about these physical changes. So we're trying to develop a medication to be used in combination with these therapies. To do this, we're looking at certain kinds of opioids, which have been shown to be effective in decreasing cocaine use in monkeys. These molecules help to correct the changes that cocaine has had on the brain. They interact with one type of opioid receptors called kappa opioid receptors to activate them. And once activated, these receptors help to reverse the effects that cocaine has had on the brain. We can think about using a molecule to activate an opioid receptor as hitting a light switch to turn on a light. But it's not quite as simple as hitting one light switch. There are many copies of the kappa opioid receptor in the brain, and we want to activate as many as we can to get the greatest effect. It's more like a panel of light switches. The more switches we turn on, the brighter the room gets. Unfortunately, when we turn on these lights, there's a bad side effect. These molecules make people feel terrible. This side effect is called dysphoria, and it's described as an intense feeling of unease or dissatisfaction. Clearly, a substance that causes this effect won't make a very good medicine. My research focuses on trying to get rid of this side effect. But since the side effect is caused by the same thing that causes the effect that we want, the activation of kappa opioid receptors, we can't get rid of the side effect by getting rid of this activation. If we don't turn on the light switches, the room is going to be dark. Instead, we're trying to find a way to overcome this side effect. So I'm making new molecules that do two things. They activate kappa opioid receptors, but they also activate a second type of opioid receptors called mu opioid receptors. Think about this as turning on a different light switch that corresponds to a different color of light. But again, remember that it's a panel of light switches that we're dealing with. Activation of mu-opioid receptors makes people feel really good. So we want to use this effect to balance out the bad feelings that result from activating kappa opioid receptors. We have to be careful though. The state of intense happiness that comes from activating mu-opioid receptors is part of what causes some opioids to be addictive. We want to turn on just enough of this second kind of light to cancel out the bad feelings from the first one. But we have to be careful not to turn on too many, or we run the risk that this kind of drug will be addictive itself. So, while we want to activate all of the kappa opioid receptors, we only want to activate some of the mu-opioid receptors. If we're able to do this, we'll be well on the way to creating a drug to treat drug addiction.